Anin Buju band members, today is Monday, January 24th. I would like to begin talking about the vaccine mandate for healthcare workers. On this past Friday, January 21st, I signed Executive Order 2023 requiring that all healthcare workers employed by the Mille Band of Ojibwe be vaccinated against COVID-19. The executive order was issued after the federal attorneys advised the band that as a recipient of Medicare or Medicaid funding, the band is required to comply with the vaccine mandate issued by the Center for Medicare and Medicaid Services on November 5th, 2021, or risk loss of federal funding. CMS will begin enforcement soon, and the hard deadline for showing good faith efforts to comply with this mandate is January 28th, 2022. So this executive order had to be issued and it goes into effect immediately. The ban is required under federal law to comply with the vaccine mandate. And if we don't comply and we are non-compliant, that means we could risk losing federal funding. And so the executive order applies to all healthcare workers and must be implemented immediately in order to meet federal deadlines. This will affect the health and human services areas as follows: Niyashin clinics, public health, dental, and the ALUs. At the state of the ban, I announced that I was issuing an executive order to require that all of our executive employees be vaccinated. But what happened with that is that particular executive order was rescinded based on a Supreme Court ruling that said that OSHA could not require all of those vaccination by the employees. But this new one is based on Medicare and Medicare. And I know it gets confusing sometimes when it happens, but when the Supreme Court makes a decision and it impacts the ban, we have to make sure we follow that. And I'm very thankful to the attorneys and staff that alerted us to make sure that we comply with this new requirement. The Mille Reservation band member cases, and this is for District 1 and District 2A, we have 268 cases. And as of last Tuesday, that's 11 new cases. In District 2, still at 59, no new cases. In District 3, 4 new cases. We are now at 83. Last week, we had a discussion with Governor Walz about opportunities with the upcoming budget. The governor and lieutenant governor are investing in students, workers, communities, and small businesses. With the historical state surplus, Governor Walz is proposing distributing some of the money back to the Minnesotans, and I know many of us will be happy for that. Other proposals are directed towards increasing educational opportunities to historically disenfranchised students, cutting taxes for families and small businesses, and ensuring broadband access for every Minnesotan. And there are some other proposals as well. So I'm looking forward to our discussion. At our meeting last Thursday, the governor did state that he would call each of the tribal leaders and discuss issues that are important to us. And so I currently have my document that I will send to him so he knows what the position is for the Mille Band of Ojibwe. Very happy with Governor Walz and Lieutenant Peggy Flanagan. First time in my history as being the chief executive that we've had a governor that works so well with tribes. Last week, I received an invitation from the White House to be a part of an educational update panel with other tribal leaders on the infrastructure bill, and that is going to happen today about 3:30. So there are a total of about 6 tribal leaders that were selected across Indian country, myself included, that we are going to participate in a virtual tribal meeting with President Biden's bipartisan infrastructure law coordinator, and his name is Mitch Landrieu. And our discussion will to give a little education about our tribes and also around priorities related to tribal infrastructure. So I'm looking forward to that. I received a lot of correspondence just about on every topic there is, and one that caught my attention, and that is about an excellent opportunity for emerging tribal public health professionals. It is called the Indigenous Public Health Leadership Program. So what it is, it's a 6-month leadership institution providing training in core public health with a focus on key issues impacting tribal communities. And the first informational webinar will be on January 27th. And if this is something that you are interested in or have friends or family that may be interested as well, please look on the Facebook for this information. Last week, I had the opportunity to meet some sponsors. Our We Win chapter is coordinating a young women's leadership conference, and that's going to be in March. And I had the opportunity to meet with the sponsors to talk about what kind of educational and opportunities we can provide for these young women that are going to attend the conference. Also, another meeting I had today so far was with the Minnesota Board on Aging, and they provide funding to many area agencies, and the Indian agencies is operated by the Minnesota Chippewa tribe called the Minnesota Indian Area Agency. And so there's some funding, there is funding opportunities and corrections and other things that always have to be made when you run a program. And because I am a board member on the Minnesota Board on Aging, they included me in this discussion. And there will be a meeting at the Minnesota Chippewa tribe this week to discuss that. And what is the best way for the Minnesota Chippewa tribe to provide services to our elders, especially up north, that include Leech Lake, White Earth, Boys Fort, and Grand Portage. I am always interested in what kind of resources are available and like to advocate for those services to make sure we provide best services that we can for our elders. So with that, I'd like to say good day, and I will talk to you soon.